Okay, now we're going to talk about diabetes and how it pertains to your vision. Um, we see quite a bit of patients every single day, 30 patients a day. We have very little time to appropriately educate. So let's get started. I'm going to go ahead and download this file. You're just going to click and it will automatically download the file. Brochures give the patient an additional way to learn and comprehend the task that you're going over. We're going to open in Pages here, Diabetes and Vision. Pop it up right there, and then we're going to click on that. Patients will better understand this information when it's presented verbally as well as visually. We see about 1 in 2 patients has diabetes in our office. We see a lot of diabetic patients, and they simply want to know, how does this affect vision? And as you can see, this clearly gives them an indication of how it would affect their vision, if not worse. It can cause blindness, as we know. And that gets to the bottom. Diabetes is now one of the leading causes of blindness because of this obesity epidemic. One thing that we tend to get in the habit of doing is telling patients what not to do as opposed to telling patients what to do. Patients tend to respond to things, telling them what to do. For example, telling them the foods that they should eat as opposed to the foods that they should not eat. Now this gets to the 7 diabetic superfoods. Now we all know green leafy vegetables, as many vegetables. We want them to load their plate up with the vegetables. We want them to load their plate up with wild salmon. We want them to load their plate up with berries. We want them to load their plate up with olive oil, beans, lean chicken, and cinnamon. All these have been proven with their own independent research and studies to help lower and control blood sugar. So these are the foods that we want them to eat as opposed to foods that they need to stay away from. The more they eat of this, the less likely they're going to have those sweets. So we need to kind of simply give them some information on where diabetic retinopathy stems from. It really stems from their blood sugar. This gives them some action steps for them. Now, as it pertains to the eye, some people want to know a little bit more on how it pertains to the eye. You can see here that we got an OCT image of retinal edema. We got a blot hemorrhage as well, and it is causing some swelling within the retina itself. So it kind of gives them a visual aid of how diabetes can affect your retina and stage organ damage, and how important it is for us to detect this early. Early detection is critical in diabetic retinopathy. That way we can minimize scarring. So this gives them a visual aid on that importance. The other thing is neovascularization. This is just pointing to NVD, neovascularization of the disc. New blood vessels, grow. This is called neovascularization. Needs prompt treatment, anti-VEGF, and/or laser therapy. Just keep it as simple as that. We don't need to go into any elaborate or profound ideas here. We just simply need to keep it as simple as possible. Now let's say again you don't like the way this looks. You just click on this, click and hold. I tend to move it when I hold it like that. So let's say, there we go. So you can you can type whatever you like. You can add whatever information. These are completely workable. You can cut, copy, delete. There's so many things that you can do here working with this Pages document. Going down, let's say you want to add your own photo. Some patients tend to be a little more visual, or I should say a little more verbal in their learning. They like to read and comprehend things as opposed to just looking at a picture, and this gives them some information to go from. I wouldn't go too far into detail with this. Just keep this as simple as possible. You just want them remembering that diabetes does affect vision, and you should be seen, according to your recommendations. Now, you always want to include a picture of yourself. Again, you're just going to click and hold. See here, replace. and you're going to replace it with an image of your liking. Let's go here. We're going to replace it with this image. Very simple, very easy to work with. All you're going to have your staff do is email the document to you, so you can save it to your iPad, and you can easily save photos and images, or even take photos and images from your iPad. But the iPad gives you the freedom to work from everywhere. Again, you can simply just create a PDF file and have the patients view this from anywhere. You can also print, email, send to iTunes. You got several formats you can work with: Pages, PDF, or Word.